The United Nations says there's no fuel to operate generators at hospitals across Gaza, placing the lives of patients and newborns at grave risk. Health officials there have warned the few healthcare facilities still able to offer services will be forced to shut down. The World Food Programme donated 2,000 litres of fuel to Nasser Hospital in Khan Yunis, the biggest hospital in southern Gaza, but that's only enough to last 24 hours. Doctors Without Borders has warned 3 hospitals in Gaza are on the verge of closure. That's the Nasser Hospital, Al-Aqsa Hospital, and European hospitals are also at risk. The aid agency says a fuel shortage is threatening the lives of patients, including newborn babies. It says incubators need uninterrupted electricity to power the ventilators that provide oxygen to keep the babies alive. The charity says newborns are already extremely vulnerable and transferring them to other hospitals would endanger their lives. It goes on to say that putting the lives of children at risk like that is unacceptable. Let's get an update from Al Jazeera's Hani Mahmoud, who's in Deir, central Gaza for us. Hani, what's the latest you're hearing about the situation at these 3 hospitals?
Well, as soon as we arrived to the site here, we did a quick tour inside the hospital. We could clearly hear the sound of machines still beeping, but not as much as it used to be in the past few weeks. And we know this sound is going to go silent very soon. And people who are relying on these machines are going to be at risk of losing their lives if fuel cuts here at the hospital. Really, major parts of Al-Aqsa hospital been downsizing on many of the services in order to provide enough and sufficient fuel for the other essential department like the ICU. And we know soon enough, without the fuel, the ICU will be forced to shut down, similar to what happened at Nasser Hospital. But again, the 2,000 liter, the 200,000 liter that were donated by the organization to Nasser Medical Complex, we know it's only going to be enough for 24 hours, and we're going back to the same exact problem. This has been going on for quite some time, and combined problems, just the ongoing deliberate closure of borders and the deliberate prevention of entry of fuel trucks to UNRWA and other organizations coordinating for the operations of the hospital, including the WHO, as well as the power vacuum created by the ongoing bombing campaign that created favorable conditions for looters to spread and to grow much violent across the central area and the southern part of the strip, and they are heavily protected by the Israeli military, and they go on and stealing much of the needed supplies, including the fuel now for the hospital. We're expecting this to increase, and we know this nearly depleted fuel for the generators here are jeopardizing the functionality of major medical equipment. The ventilators, the incubator inside the hospital here are at risk now of shutting down as the problem continues. And without any reasonable solution to this, without the sufficient flow of fuel, these health facilities will turn more of a graveyard soon. And we know how people are in need of this facility to continue operating, even if it's operating at the lowest capacity now, but they need it to continue and to sustain itself in order to save life.
Hani, thank you very much for bringing us the latest there from Gaza. Hani Mahmoud.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.